film everybody and then have you ever leaned back in your chair to the point you almost tipped over? Did you experience a sensation of panic, knowing that you were about to experience pain, but couldn't do anything to stop it? What if you got stuck feeling that sensation all the time? How far would you go to make that sensation go away? Would you isolate yourself from your friends or family? Would you drink or use drugs? Would you abuse substances to the point of blacking out? What I just described is a very apt metaphor for the realities facing a person that is simultaneously battling both substance use disorder and post-traumatic stress disorder. Many of us are familiar with the image of an addict or an alcoholic. We see depictions of it in the media, we see them in our communities, and occasionally in our personal relationships. What we may not see are the underlying psychological conditions that can be a contributing factor to this behavior. The link between substance use disorder and post-traumatic stress disorder has become increasingly well established in recent years. Becoming better informed on this topic will allow you to recognize the symptoms of this growing comorbidity and ensure that you are better equipped to offer support and guidance when you encounter it. My name is Chandler Henry, and I am a combat veteran who has been diagnosed with post-traumatic stress disorder. I am also an alcoholic and an addict in recovery. Today I would like to educate you on some of the statistics surrounding the link between these two issues, giving you pointers on identifying the symptoms and educate you on how best to address these issues when you encounter them. I would like to begin by giving you a better understanding of post-traumatic stress disorder and how it manifests. Post-traumatic stress disorder is defined by the American Psychiatric Association as a mental health condition that is caused by exposure to a traumatic or life-threatening event. The symptoms for post-traumatic stress disorder vary, but are typically characterized by avoidance, intrusive memories or thoughts, heightened arousal, irritability, and insomnia. It is estimated by the Department of Veterans Affairs that 6% of Americans will experience post-traumatic stress disorder at some point in their lives. The prevalence of post-traumatic stress disorder rises among combat veterans, with an estimated 29% of veterans from the Operation Iraqi Freedom and Operation Enduring Freedom campaigns being diagnosed with post-traumatic stress disorder at some point in their lives. These numbers among veterans are not always combat related. Traumatic events during training and military sexual trauma also contribute to these numbers. Now that you have a better understanding of post-traumatic stress disorder, I would like to take this opportunity to get you a little background on substance use disorder. Substance use disorder is classified by the DSM-5 as a mental health condition that is characterized by a problematic pattern of substance use leading to significant impairment or distress. Substance use disorder is diagnosed by 11 different metrics, which are craving, tolerance, withdrawal, using larger amounts over longer periods of time, unsuccessful attempts to cut back or stop, neglecting major roles, much time spent using, social or interpersonal problems, risky use behaviors, physical or psychological problems, and giving up loved activities. It is estimated by the Substance Abuse and Mental Health Services Administration that 48.4 million Americans had a substance use disorder in 2024. Current studies suggest that there is a higher rate of substance abuse among veterans, with 7.5% of veterans reporting heavy use of alcohol in line with dependence versus 6.5% in non-veteran communities. Now that you understand some of the information surrounding both substance use disorder and PTSD, let's take a look at where and how these two overlap. The link between substance use disorder and post-traumatic stress disorder is well established, with high rates of co-occurrence. A recent study published in the Journal of Traumatic Stress noted that nearly 60% of individuals with post-traumatic stress disorder also suffer from an alcohol and/or drug-using disorder. One of the more common reasons patients with post-traumatic stress disorder report using and eventually abusing drugs or alcohol is to combat or mitigate the symptoms of PTSD. Symptoms such as nightmares, difficulty sleeping, irritability, and depression. Individuals with both disorders often experience more severe symptoms and poorer treatment outcomes. They also see an increased rate of suicide risk. This is one of the reasons for the urgency surrounding this issue. Many individuals are not surviving long enough to see social pressure, for social pressure to create a climate of understanding and advocacy surrounding this issue. Effective treatment requires addressing both issues simultaneously. There are significant gaps in care, with fewer than 20% of substance abuse treatment programs screening for post-traumatic stress disorder. Given all this information about the issues surrounding these two mental health conditions, the logical next question is, what can be done to help? Some ways that you can help include recognizing the symptoms of both post-traumatic stress disorder and substance use disorder, offering support and guidance to those afflicted with these conditions, and advocating for integrated trauma-informed approaches to treatment. In conclusion, we have discussed post-traumatic stress disorder, substance use disorder, their definitions, prevalence, and comorbidity. We have also learned how to recognize symptoms and the importance of integrated treatment. Now that you are more familiar with these important issues, you will be able to offer support and help reduce stigma. You will also be able to advocate for better awareness and integrated care for those affected by post-traumatic stress disorder and substance use disorder. Because when we address the whole of the issue by seeing the person and not just the disease, we create a better path towards healing. Thank you.
All right, buddy.
Well done, Chandler.